Hey guys, so today we are going to learn about the adverse effects of phenytoin. This is not a video to build your concept. This is more of a video that you need at the last minute because you have an exam tomorrow and you're unprepared, or you just need a revision. Everything in this video is from KDT, so you're good if you mention all of this in a paper or during a viva. We divide the adverse effects of phenytoin into two categories. One, which happens due to therapeutic concentration of phenytoin in the plasma, and the other due to overdose of phenytoin. So, coming to the therapeutic concentration adverse effects, we'll look at phen. This is my stick figure called phen. We'll look at his adverse effects from top to bottom. The first thing that we notice is hirsutism, in which you can see that there's coarsening of the facial features and acne. This usually occurs in younger patients. Then we have gum hypertrophy. This is the most common adverse effect of phenytoin, and it happens due to overgrowth of gingival collagen fibers, and that is why there is gum hypertrophy and bleeding from the gums. Then we have hypersensitivity. There's rashes, there's neutropenia, and then there's DLE, which is discoid lupus erythematosus. When these adverse effects are seen in a patient, we have to discontinue the therapy. The fourth adverse effect that we see and we like to call is fetal hydantoin syndrome. This happens when phenytoin is administered in pregnant women. We can see hypoplastic phalanges, cleft palate, hair lip, and microcephaly in the fetus. And this occurs due to an metabolite called arene oxide. Then we have osteomalacia and megaloblastic anemia. Both of these adverse effects occur due to phenytoin interfering with the absorption or activation of vitamin D and folate. And due to folate deficiency, we'll have megaloblastic anemia. And because vitamin D is not getting activated sufficiently, we'll have osteomalacia. So these are the therapeutic concentration adverse effects of phenytoin. Just a quick recap. We have hirsutism, gum hypertrophy, hypersensitivity, pregnancy, osteomalacia, and megaloblastic anemia. If you just remember this diagram and go to the exam, you can draw this on the side of the paper, and then from top to bottom you can remember these adverse effects. It's way easier like that. Then we have overdose toxicity. We have 5 adverse effects that happen due to overdose toxicity. This is because there's an increase in the plasma concentration. The first adverse effect that happens is they are the cerebellar and vestibular manifestations. We have vertigo, ataxia, nystagmus, and diplopia. I like to remember them as VAND. Cerebellar and vestibular manifestations, VAND, vertigo, ataxia, nystagmus, and diplopia. Then there's these manifestations, and I like to remember them in this sequence. First, we have drowsiness, and due to drowsiness, the patient is confused. There's mental confusion. Then we have hallucinations, we have behavioral alterations, and rigidity. If you remember them in this sequence, you'll find it easier. Drowsiness, mental confusion, hallucination, behavioral alteration, and rigidity. Then we have the adverse effects that we see for almost every drug: epigastric pain, nausea, vomiting. I like to remember them as VPN. So far we have VAND, we have VPN, and next we'll see the adverse effects of IV phenytoin. When we give IV phenytoin, it causes local vascular injury, and because of that there's intimal damage in the blood vessel, and there's thrombosis of vein, edema, and discoloration in the area where the IV phenytoin was administered. Plus there is tissue necrosis when there is extravasation of phenytoin that was administered. So this is an important point, and if you mention this in viva, teachers are usually very impressed. Then we have fall in BP, and we have cardiac arrhythmias. These occurs due to the IV injection of phenytoin only, and that is why when we give IV phenytoin, we like to give it with ECG monitoring, so we can keep an eye on this and this. And that's it. If you categorize them like this and mention all the points, I'm pretty sure you'll get good enough marks in the question. And in viva, if you just enumerate these points, and mention the main features of these points, you'll be good to go. Thank you.